Do you feel tired all the time, less motivated, weaker in the gym, or simply not like yourself? You might immediately blame low testosterone. But before you buy a supplement, start a so-called hormone hack, or assume you need testosterone therapy, take a closer look at your daily habits. Some common lifestyle mistakes can interfere with sleep, recovery, energy balance, and overall hormone health. In this video, we'll cover 5 mistakes that may contribute to lower testosterone or make low testosterone symptoms feel worse. And mistake number 3 is something many hardworking people do because they think more training is always better. Let's get into it. Before the 5 mistakes, one important point. Feeling tired or having a low sex drive does not automatically mean your testosterone is low. Similar symptoms can be linked to poor sleep, stress, depression, certain medications, obesity, thyroid problems, diabetes, sleep apnea, or other health conditions. Clinical guidelines recommend diagnosing testosterone deficiency based on compatible symptoms plus consistently low laboratory results, not symptoms alone. The Endocrine Society recommends confirming a low result with repeat early morning testing using a reliable method. So use this video as a checklist for healthier habits, not as a diagnosis.
Mistake 1. Chronic sleep loss. The first mistake is consistently sleeping too little or sleeping at completely different times every night. Sleep is an active recovery process that supports mood, metabolism, and hormone regulation. Repeated short sleep can mean lower energy, worse concentration, more cravings, reduced training performance, and symptoms that overlap with low testosterone. Sleep disorders, including obstructive sleep apnea, are also associated with lower testosterone. The bigger concern is a repeated pattern of late nights, irregular schedules, phone use in bed, loud snoring, or daytime sleepiness. Set a consistent wake-up time, make your bedroom dark and cool, reduce bright screens before bed, and allow enough time for sleep. Many adults need around 7 to 9 hours, although individual needs vary. If you snore loudly, wake up gasping, or feel exhausted despite enough time in bed, ask a healthcare professional about sleep apnea. The goal is to stop treating sleep like it is optional.
Mistake 2. Extreme dieting. The second mistake is extreme dieting, especially severe calorie restriction, repeated crash diets, or trying to stay extremely lean while training hard. Your body needs energy and nutrients for basic functions, movement, recovery, and hormone production. When intake stays too low for too long, you may experience fatigue, poor workouts, irritability, reduced libido, and difficulty recovering. This is not an argument against fat loss. Losing excess body fat can improve health, and obesity is associated with lower testosterone in some men. The problem is skipping meals, cutting out food groups without a medical reason, or maintaining an aggressive calorie deficit for months. Choose a moderate, sustainable plan built around adequate protein, vegetables and fruit, whole food carbohydrates, and healthy fats. Adjust portions for your goals, but do not ignore persistent hunger, declining performance, or constant exhaustion. If you train intensely or have a history of disordered eating, a registered dietitian or qualified clinician can help. Hormone health is not improved by starving yourself.
Mistake 3. Overtraining without recovery. The third mistake is training hard every day without giving your body enough recovery. Strength training, sports, and regular physical activity are generally good for health, but more is not automatically better. If intense training is combined with insufficient sleep, too little food, dehydration, or constant mental stress, you can accumulate fatigue faster than you can recover. Warning signs may include a sudden drop in performance, persistent soreness, irritability, poor sleep, unusually high fatigue, loss of motivation, or getting sick more often. These signs do not prove that your testosterone is low, but they do suggest that your current training and recovery balance may need attention. The solution is not to stop exercising, it is to program recovery. Alternate hard and easier sessions, include rest or active recovery days, eat enough, hydrate, and track performance and energy instead of judging yourself by effort alone. Training is the stimulus, but recovery is where adaptation happens. A good program should make you stronger over time, not like exhausted every day.
Mistake 4. Too much alcohol. The fourth mistake is frequent heavy alcohol use. Alcohol can disrupt sleep quality, increase dehydration, make recovery harder, and affect reproductive hormone pathways. Heavy or frequent drinking is also associated with changes in mood, body weight, and sexual health. Falling asleep quickly after drinking does not mean you got high-quality sleep. Alcohol can fragment sleep later in the night. Honestly evaluate your pattern. Are you drinking most nights, using alcohol to handle stress or sleep, or regularly drinking more than planned? Reducing your intake may improve several parts of your health. If you drink heavily every day, do not suddenly stop without medical guidance, because withdrawal can be dangerous. Talk with a qualified healthcare professional about a safe plan. The goal is better sleep, recovery, and long-term health. Mistake 5. Ignoring chronic stress like it is harmless. Stress is a normal response to challenges, but constant stress can affect sleep, appetite, mood, recovery, and exercise consistency. It can also make fatigue and motivation harder to interpret. Stress is not a simple switch that turns testosterone off, and one stressful day tells you nothing definitive. But months of pressure combined with poor sleep, irregular eating, and inadequate recovery can add up. Try a daily walk, short breathing, or relaxation breaks, time with supportive people, fewer unnecessary notifications, and a consistent sleep routine. If stress feels overwhelming or persistent, consider speaking with a mental health professional. Managing stress is part of maintaining your overall health. So what should you do this week? First, create a consistent sleep and wake schedule. Second, stop extreme dieting and build balanced meals that support your activity. Third, review your training plan and schedule recovery before your body forces you to rest. Fourth, take an honest look at alcohol and reduce it if it is affecting your sleep or daily life. Fifth, choose one stress management habit you can practice every day. Do not change everything overnight. Pick the habit most obviously harming your routine, track it for 2 to 4 weeks, and notice whether your energy, sleep, mood, workouts, and libido improve. Lifestyle habits can support health, but persistent symptoms deserve an evaluation rather than guesswork. Low testosterone requires the right context. Persistent low libido, erectile difficulties, unexplained fatigue, reduced muscle strength, or mood changes deserve a conversation with a healthcare professional. Evaluation may include your history, a physical exam, and appropriately timed laboratory testing. Do not start testosterone or hormone supplements based only on an online checklist. The 5 mistakes we covered are chronic sleep loss, extreme dieting, overtraining without recovery, frequent heavy alcohol use, and ignoring chronic stress. Fixing these basics may support your energy and overall health, but if you are concerned about testosterone, get reliable medical advice.